Our next guest arrived in the US with just $100 in her pocket and is now a biotech leader working as the Chief Medical Officer at Ocugen. Good morning, Dr. Huma Qamar. How are you, Doctor?
Good morning. How are you? I'm doing great.
Good.
Great to see you.
Yeah, I'm doing very good too. This is fascinating. Does that arrival with $100 in your pocket still resonate with you and still drive you forward?
Yes, absolutely. And I think when I started off, I had no clue that those $100 would be a milestone in my personal and professional journey. So I just think that, I took, with faith, I started my journey many, many years ago. And I still think that those $100 were not only just $100, those were just matter of determination and perseverance. And I think I did at that time had a goal in my mind how to move forward. And actually, America was a land of opportunities for me, and I wanted to achieve every single dream of mine as a women leader.
Yeah, you've certainly done that. I mean, you've worked at prestigious institutions like Yale, Penn, Harvard. What have those experiences taught you about the leadership and innovation side of things?
Yeah, that's a great question. Actually, Yale, Harvard, University of Pennsylvania have taught me just one thing, that hard work is a check that can be cashed anywhere and everywhere. And what I feel is this, that your dreams can come true if you are a hard worker, you believe in your dreams, and also if you are passionate about a certain cause and you have a mission and vision in your life to a certain cause, you are going to be successful regardless.
Yeah, we mentioned earlier as well that now, of course, you're the Chief Medical Officer at Ocugen. So what motivates you every day in your role as the CMO?
Well, as a chief medical officer, the first and the foremost thing is the patients. And of course, as a company, Ocugen is a patient-centric biotech company where the mission and vision is to cure blindness diseases such as Stargardt disease, retinitis pigmentosa, geographic atrophy, and many other blindness diseases. So what motivates me is the patients. And when they are reaching out to me and when they're asking me, okay, we need help. So every day I am, waking up with this one goal in mind, that I have to treat, find a treatment for these patients with blindness diseases. Not only that, one of the other things that motivates me every day is, of course, improving myself, as well as not only personally, but also professionally. And coming up, I want to be a role model for all the women leaders, all the women who want to be in this position, and also my team. That's just one thing that I have, developed over the years and promoted people, and have been the leader that has been part of their lives, both professionally and personally as well.
As someone at the forefront of medical innovation, how do you stay inspired and creative in such a demanding field?
I think it's very challenging. However, what I do is that my surgery professor has taught me that your eyes cannot see what your mind doesn't know. So I'm a visionary leader with an achiever mindset. I see things 10 years in advance and kind of look at where there is unmet need, medical need, or, I kind of strategize those accordingly. However, it is very difficult and kind of, in the day-to-day, I would say in this field. However, if you have a certain mindset of achieving things and you are a visionary leader with an executive mindset, I think you can achieve it all.
Yeah, looking back on your astonishing journey, is there a defining moment that shaped who you are today, both personally and professionally?
Yes, it is. I think many, many years ago, when I was with one of the patients, and a very young patient, I started off my journey in oncology, and that patient changed my life. And one of the things the patient told me, and the patient was a child, is that I want to see the birds. I want to live more. And can you find some cure to this particular cancer? And I think that was where I inculcated science and medicine with kind of, I would say, forward thinking. And I came a long way from that process, but I think that child taught me that, you have to think outside the box. In fact, I always believe that there is no box to start with. And that patient of ours is doing great. And that was one thing that motivated me many, many years ago. And I would give that to that particular patient who actually motivated me to be that person who created positivity, not only in her life, but also in the lives of many other patients.
Well, Dr. Huma Qamar, thank you so much for your time this morning and for all that fascinating information and insight.
Thank you so much. It was my absolute pleasure.
Thank you. Now, if you're inspired by this segment and would like to see it again, you can watch it back and all our past segments by visiting vegasmorningblend.com.